If North Texas starts running out of ICU beds, doctors may have to consider coronavirus vaccination status as a factor in who gets priority care, a situation health officials hope to avoid but worry is becoming increasingly likely, with the vaccinated potentially being prioritized for treatment on the assumption that they're more likely to survive. Our situation is bad, and if numbers continue in the direction they're going, there is a realistic potential that triage guidelines will need to be utilized, Casanova said in an interview. 80. That's how many ICU beds are available in the Dallas area, according to the Texas Department of State Health Services. The population in the area is around 8.1 million. New COVID cases and hospitalizations are skyrocketing in Texas with no signs of a slowdown. As of Wednesday, there were 12,402 patients hospitalized with COVID-19 in Texas, a number that is quickly approaching the pandemic high of just over 14,000 back in January. Texas is one of several southern states where the Delta variant has caused COVID cases to spike uncontrollably, leading to devastating impacts on healthcare systems. In Mississippi, health officials opted to open a field hospital in a parking garage to take the strain off regular medical facilities, while Alabama now has more patients in need of intensive care than the number of designated ICU beds in the state can take. And on Wednesday afternoon, officials in Mobile, Alabama, which has a population of almost 200,000, decided ambulances could no longer transport people to the hospital since emergency rooms were overwhelmed with COVID patients. It does not appear vaccination status is being used as a triage factor in these areas, though. Using survival chances to prioritize who received care was a distressing step taken by Italian doctors in the early days of the pandemic, when healthcare systems were overwhelmed there by the number of patients needing treatment. If North Texas runs out of ICU hospital beds, doctors can consider a patient's vaccination status. The Dallas Morning News, critical mass level 0, ambulances in Mobile, Alabama, stop taking people to hospitals amid COVID surge. Forbes, full coverage and live updates on the coronavirus.